Good to go? Yeah. Good afternoon, and thank you for joining us. As many of you are aware, Health Canada recently approved Moderna's Spikevax vaccine for children aged 6 months up to 5 years of age. This means that the vaccine is considered safe and effective for young children. I am pleased to announce that on Monday, August 1st, our province will begin administering the COVID-19 vaccine to children aged 6 months up to 5 years through community vaccination clinics. Parents can book an appointment by visiting our COVID-19 website and clicking on Get the Shot. Regional health authorities will be opening up clinics day by day, so if you don't see availability in your region right away, please check back for updates. This vaccine is 25 micrograms, which is 1/4 of the dose of the Moderna Spikevax vaccine that we offer for adults. For our youngest age group, the full series consists of 2 doses, given at least 8 weeks apart. Children who are immunocompromised should receive 3 doses to help boost their immune response, and in that situation, the doses may be given 4 to 8 weeks apart. For our children who are aged 5 years and older, we will continue to offer the Pfizer-BioNTech vaccine. For children who are about to turn 5, we recommend that your child get the vaccine at the time that it is offered according to their age. Children who receive Moderna Spikevax for their first COVID-19 immunization and who have turned 5 years of age by the time they are ready for the second dose, should be given the Moderna Spikevax for their second dose. If your child has had a COVID-19 infection, they may be vaccinated when they are considered recovered. To help boost their immune response, you can wait at least 8 weeks after recovery from COVID-19 infection before getting a first or second dose. Parents can talk with their healthcare provider about the best time for their child to receive the next dose. We know that there is waning immunity after COVID-19 infection, and receiving the vaccine after an infection boosts that immunity and helps it to last longer. Hybrid immunity from both infection and vaccination has shown to be stronger and last longer. While the majority of COVID-19 infections in young children are mild, we know that some children will become very sick and some will require hospitalization and some even ICU admission. We have seen increased hospitalizations in the 6-month to 5-year age group since the rise of the Omicron variant and the increased case numbers that we have experienced. We are currently seeing increased COVID-19 activity in our province as the BA.5 Omicron variant is now dominant and is more transmissible than previous variants. COVID-19 affects everyone differently, and some people may end up in hospital if they are infected. We can protect our children from severe outcomes by getting them vaccinated. The vaccine efficacy against symptomatic disease is comparable to what we've seen in older populations during this Omicron wave. Real-world experience has shown that the vaccine works very well in preventing hospitalization and severe illness and avoiding prolonged symptoms following a COVID-19 infection. This is what is the most important. As a doctor and as a parent, I know how much we all want to keep our children safe and healthy. When my children were young, getting them vaccinated was so important to me. It gave me reassurance that I was protecting them from serious illnesses such as measles, mumps, rubella, and polio. In Newfoundland and Labrador, we are leaders in the country in administering childhood vaccinations and hope to see the same strong uptake for this pediatric vaccine. There are just under 18,000 children in this age group that are now eligible to receive this vaccine. It is important for all people of all ages to get every COVID-19 vaccine dose that you are eligible for, even if you've already had a COVID-19 infection. This is still our best tool to help prevent serious illness and avoid hospitalizations. As you know, as you would have seen reported in our online COVID-19 dashboard yesterday, there are currently 17 people in hospital due to COVID-19. I know this number may seem high, but this is much lower than we were anticipating for the end of July. This is a strong signal that our vaccines are working. I am happy to report that 62.2% of people aged 12 and older have received at least 3 doses of COVID-19 vaccine. This is currently the highest rate in Canada, but we need to get this number higher. Getting up to date with your vaccine will provide you with the best protection. To get up to date with your vaccine, you can check with your local pharmacists and physicians for availability. To book a vaccine appointment through a regional health authority clinic, you can go online by visiting our COVID-19 website and clicking once again on Get the Shot. Thank you to everyone for doing their part and making the choice to be vaccinated. I will now take questions from the media.
Seviour, I'm wondering about distribution. For adults, pharmacies seem to be the main way that people are encouraged to get it. Why not distribute some of the childhood vaccine through those channels as well to give more opportunity, especially because I'm betting parents will be seeing a lot of no appointments available and getting frustrated?
Yeah, so that's a great question, and what it is that this falls outside the scope of practice of a pharmacist in terms of the age. They're not licensed, if you like, or to give a vaccine to this age group. So we'll be using the community clinics that we use for all our childhood vaccinations.
Both serious illness from COVID-19 as well as adverse events in this age group are very rare. That's kind of a strange thing for a parent to wrap their heads around if they're trying to make the best decision for their kid's health. So what would you say to that? Again, like I said, it's very unlikely they're going to get very sick from COVID. Very unlikely they're going to have an adverse event from the vaccines.
Yeah, so for me, I guess, you know, you're right? But when we don't, thank goodness, we're seeing milder illness in children and in this age group. But I guess one of the reasons I always vaccinated my children, one of the things that, one of the ways, everybody's got a different level of risk aversity. But to me, when it happens to your child, it's 100% then. So that's always been, you know, that's always part of my risk assessment, I guess. So, and the other issue is even, and people might be thinking, oh, my child just got infected with COVID, so I'm not really worried. But we know, just like the vaccine, unfortunately, that's a waning immunity, right? So they can get infected again. So it also affects, you know, school, their social activities, you know, the reactions with their household, because we get the more disruption with illness. So that's another reason, I guess, for me that it's important. But to me, that the important thing is those severe outcomes. You know, even though they're not as frequent, with the increase, just because the way math works, with the increased number of cases, we were seeing more hospitalizations across the country in that age group.
Are you able to give us an idea of the number of hospitalizations within that younger age group that we've had in Newfoundland and Labrador?
I don't have that number with me, but I certainly could provide it to you.
Okay.
This age group was one of the last hurdles, I guess, in terms of vaccinations. Just speak to how significant it is to finally be able to vaccinate this age group.
I have no idea how I feel today. I mean, when I started in March of 2020, we had no vaccinations. We didn't know a lot about COVID. We were battling a new virus. And, you know, to me, the amazing work that was done in the COVID-19 team here in this department and all throughout the RHAs. And I said that when we met with the nurses the other day, what they've accomplished, the amount of the population that has been vaccinated. What did I tell you there? We've got 62.2% of people aged 12 plus that have had at least 3 doses. That's a lot of work by our pharmacists, our physicians, our public health nurses, and just the organization that goes behind that, from NILCHI setting up a system so people can go in and easily book it, to the parents who bring their kids out, and to the adults who take the time to go get their vaccine. So to me, you know, I couldn't have imagined in March of 2020 that in July of 2022, I would be sitting here and saying we're now going to protect that last group of the population. And it gives me goosebumps, to be quite honest.
Children in this age group get several doses of different vaccines. I think 6-month needles are a regular thing. How does this vaccine interact with those? Like, what's the timeline that they have to wait in between, or can they get it at the same time?
So that's a really great question. And so NACI has made recommendations that you wait 4 weeks in between vaccines. And it was kind of what we did early on too, where we said, don't give any other vaccine within 4 weeks, because we're always monitoring for side effects. So we would want to know, was it there another vaccine that caused a side effect, or was it the Moderna vaccine? And in terms of that, we know that during the study, or during the data that's been collected and presented to Health Canada for approval, that most of the side effects were minor, you know, redness at the site, irritability, crying, fever. And we know that, I can't remember, maybe it was last week when I was reading some stuff, there have been over 300,000 doses given in the U.S., and no serious adverse signals have we received from that real-world experience either.
How important, or is it important, that we see a quick uptake in this group before the fall when they say go to school or childcare?
Yeah, and that's why I threw in there about school and your activities and, you know, all those things that the vaccine can help against. You know, I remember sitting here months ago and saying, you know, the vaccine wasn't perfect, but it was pretty damn good because we didn't get everything we wanted out of the vaccine. Like, we would have really loved what we call a sterilizing vaccine. So if you got your vaccine, you're not getting COVID infection again. We haven't been as lucky as that, you know, so you know, there is a reduction in symptomatic infections, but we all know it wanes over time, right? But it does the things you know, some of the decimation we've seen from COVID in the country, it protects against that. So to me, it is important because we're, you know, one, the severe outcomes, and two, just the interactions with life.
So going forward, like once this cohort is vaccinated, how will the COVID vaccine fit in with all the other vaccinations? Is this the sort of thing like at 6 months, this will now be part of the standard along with all the other vaccines that are given out?
It's a good question, and I don't know. I mean, with the way the vaccine, you know, the virus mutates has been an issue for us. As you know, it's been a real challenge, and but you know, we still even find, which is fortunate, you know, and also, well, I mean, good design. There's really brilliant people out there who do vaccine design. We're still seeing those, you know, that they're working against the various serious outcomes. But I don't know what it's going to look like. Anybody who tells you who they does is pulling your leg.
I was just reading the National Advisory Committee on Immunizations release on this, and they mentioned under the efficacy part that age 2 to 5 years, efficacy against confirmed symptomatic SARS-CoV-2 infection starting 14 days after the dose was 36.8%.
Yeah, and it was
like
50%, 51%
50 for,
in the
yeah.
old. Yeah.
Why are they, well, first, I guess, why are they both, if there's such a difference in the efficacy only 2 weeks after, like you mentioned, the waning immunity from it, why are these groups together and not separate? And is that a very, like, is that low? I'm not familiar with the other groups, so maybe a comparison to...
Yeah, it's quite similar to Omicron, to what we've seen during Omicron. So all this the studies of we call it the baby, we finally call it baby peds vaccine here.
Oh.
So that all happened during the Omicron, right? So it's similar to very comparable to how the vaccines in older age groups have worked during this wave, right? There's more immune escape with Omicron, immune escape from your previous infection and immune escape from your vaccine.
Is that low for a vaccine though?
I mean,
36.8%, 2 weeks after?
So that's for infection.
2 to 5.
Yeah, but and that's for infection, not, and there's also a wide confidence interval around that, but that's for infection, not severe outcomes, right? That's for your chance to get reinfected.
Yeah.
Within a period afterwards, and it's pretty good at first. So it's 30 to 50% reduction, but then we know you're gonna lose that over time, like all of us have.
What would you say to parents who might be a little worried about giving vaccines and say, look, if it's not going to prevent my kid from getting COVID, and we already know that COVID is not very severe in this age group, many of them just get the sniffles, why should I take this risk?
Yeah, so for me, for me, the issue would be that we still have seen hospitalizations and we've seen severe illness. We also have seen multi-system inflammatory syndrome in children, and we know that we don't have enough evidence yet how it impacts the little babies, but we do know that MIS-C is reduced in our adolescent groups who are vaccinated versus somebody who's not vaccinated. So right now we're assuming that we will get that same kind of reduction there too. We also know that even if you have mild symptoms, that you have an increased risk of long COVID. And that is also for children. We don't know as much in this age group what the vaccination will do with that, but we do know that it impacts the other age groups all up through the ages in terms of vaccinated to versus no vaccinated.
Thank you.
Okay. Hope I don't see you again for a long time.